Hello, can you hear me there?
Dr. Bobby Johnson, how we doing, man? How we going?
Good. Call me Bobby, Dr. Gallagher. How are you?
Cool, good. Call me Brendan.
All right. Sorry, I just had to switch to my wife's laptop. My laptop's like so full of memory that basically every time I download one document, I got to delete another document. And Riverside wasn't loving that.
I hear you. Yeah, I get that all the time. I've been doing it on my phone the last 4 years of residency because obviously it fills up, sending the text back and forth to the tendings and stuff and the videos, the CT, and it clogs up space.
Yeah. Yeah, I'll say. That's funny. It's your phone changes so quick. I mean, I'm only like 7 months out of residency, right? And just the content in your album changes so quickly.
It does. I'm looking forward to wiping it clean of all this stuff. The do not disturbs, you know what I mean.
Yeah, yeah, that's a lot. I mean, it says a lot that you're arranging meetings at 8:30 at night. That's only a resident schedule right there.
You gotta do it. You gotta do it. Actually, speaking of updates, did you get this new iPhone update?
Potentially, I don't know. Why, what's going on?
It's like my phone, my co-resident, we both did the update the other day, and now like our phones are dying twice the time speed,
Oh,
and
yeah. No, now that you say that, my battery's been dying like basically now every day, which wasn't like that 2 weeks ago.
it was a lot longer, right?
Yeah, a lot longer. That's crazy.
Dude, something's going. Man, I wish, ever since Steve Jobs died, what did they come out with? They didn't even come out with the AirPods. They just bought Beats by Dre, put the technology in the earpods. I don't know,
Have you
man.
watched the Ashton Kutcher drama about Steve Jobs?
No, no, no. What is it?
It's a movie. I just happened to was watching it this week, so it's pretty timely.
I've seen parts of it. I don't know if I've watched it front to back, but it's an interesting movie, right? I've seen some pretty good clips of it.
Yeah, it's good. I mean, I kind of like that genre. I wouldn't say it's like Social Network good, but it's a good backdrop of what Steve Jobs' life was all about and stuff. I mean, coming from, I don't know if it's at all credible, but it's a good
Yeah,
story.
The Social Network. That's one I got to see. I didn't see that one. That's one.
Wow, yeah, yeah, that one you definitely got to see.
That's a good one, huh?
Yeah, good flick.
Yeah. Yeah. So what's going on, man? How's everything going? Did you work today?
No, so, well, I did. I worked on Duo, the toothpaste company, but I didn't work. It's funny in dentistry, people only consider work when you're like actively working in someone's mouth. So I did computer work, but I didn't do clinical work today, if that's the question.
Yep. Yeah. No, I follow. I follow. So how's that going? So it's Duo. It's your toothpaste company. Can we just go through that a little bit? I want to learn more.
Yeah, so, Duo's pretty cool. It's really cool. It's a tablet toothpaste company. So what that means is the little tablets come in a glass bottle with aluminum cap, so it's recyclable. It's not like that plastic tube that's been, worked on for 100 years and everything. Totally different concept. And we started it, my wife's a dentist too. So we started it, I was in med school at the time with another couple that are friends. And now we have a small team, another member as well. So the whole thing's about 3 years old. We've only like really kind of raised money and started scaling it in the last year or so. But
Right.
it's been a really kind of, cool thing, a side thing on top of just clinical residency and clinical practice and everything, working on a little CPG startup.
Yeah, I like that. So you started this during residency, about year 4 out of 6. Is that correct?
Yeah, and it was kind of like I was in med school during COVID a little bit, so there's a lot of
Mm.
stuff in Blackson. We were actually just on a vacation, so it was a little hiatus from med school.
Mm.
And this idea kind of came up, and one thing led to the other. I mean, we kind of came up with this. So we took the whole toothpaste thing, to the next level where we have 4 SKUs. And for instance, one of them is our immunity that has vitamin D and B12 in it. We have a sleep toothpaste that's got melatonin in it. And we have a caffeine or an energy toothpaste with caffeine. So kind of after the idea for Duo came up with the tablet concept and adding functional ingredients to the toothpaste, then it was back to the drawing board for, months of just going on PubMed. And there's one toothpaste textbook in the world that I bought and that kind of thing, doing a deep dive. But it was nice between COVID and med school, you have a little more time off during med school. So I could kind of put some energy towards this. And then luckily just got a great team. So they were really able to carry the business logistics and operations for a while. And now that I'm out of residency, I will get a little bit more involved again.
Did you were making prototypes at all, or like how do you get this toothpaste?
Yeah. So I bought an industrial tablet press, and it turns out the tablet pressing world's pretty small. Like you buy this thing out of a company in Texas, but it really comes from China. And I even had to register it with the DEA. So I had this DEA officer called me one day. I was like, "So what are we making on this tablet press here?" Because according to Reddit, like 90% of Street Xanax is made with the same tablet press. It's just like
Um,
it's a two pistons basically on an electric motor, and it will spit out like 1,000 tabs a minute if you get it dialed in right. So yeah, no, it just started, in the garage. I mean, just mixing a bunch of, after we figured out kind of the breadth of ingredients that we wanted, then it was just hundreds and hundreds of trials in the garage, just going through it and kind of fine tune. There's a lot that goes into it. Like, you want the best ingredients for a toothpaste, of course, but then it's also has to compress into a tablet, and then it's got to work through the machine. So the powder has to slide, it has to compress, it has to be able to eject from the machine. And so that was a lot of trial and error for sure. A lot of bloody fingers just trying to, work this crazy machine. Yeah. So that was kind of the, how the whole prototyping went. And then once we knew we had a viable product, because we needed it to be tablet form, you had to chew it and it still foams up and feels like toothpaste and does all the things you want out of your toothpaste. And then once we had that and we had a viable product, then we went to work on the actual building of the business and the operations and stuff. And that's where a lot of our teammates came in too and still work on that. So
of course. Yeah. Do you include fluoride in your tablets?
we do not. No, we use nanohydroxyapatite. Do you know much about nanohydroxyapatite?
A little bit. I'm not a pro. I'm not an expert on it, but sure. Yeah.
Yeah. It's, we all learn about it in dentistry, and we've known about it in dentistry forever because of bone grafting, and hydroxyapatite, of course, is what teeth and bones are made out of. But nanohydroxyapatite, meaning it's a certain shape, so it's like this 60 to 80 nanometer size, it's spindle shape, was actually first developed by NASA in 1970 to help astronauts with mineral loss in a zero gravity environment in their teeth. And then the patent was bought by this Japanese company in 1970 and then tested in Japan for over a decade. And now there's been decades of research on it, and it's pretty incredible. I mean, dental schools are just starting to teach it now in the US, but it's used all over Asia and Europe. And nanohydroxyapatite, so it remineralizes teeth as good, if not better than fluoride. It whitens because it adds a new layer of enamel down, which fluoride doesn't do. It stops sensitivity because those spindle-shaped fibers of nanohydroxyapatite actually go in the dental tubules to remineralize them and stop that hydrodynamic pressure flow. And then this last one's crazy. I didn't even believe it until there's just like dozens of studies on this. It's just as effective at stopping plaque accumulation as chlorhexidine. But unlike chlorhexidine that just, wipes out the oral microbiome, it actually stops the bacteria from accumulating on the tooth surface. So it doesn't just ubiquitously kill off bacteria, but it stops the accumulation. So it's a pretty awesome thing. And it's,
intense.
We're certainly not anti-fluoride, but for people looking for an alternative, I mean, non-fluoride toothpaste used to mean it didn't work, right? But now with nanohydroxyapatite, that's not true.
Yeah. What are your thoughts on fluoride in the water?
That's such a contentious thing. And obviously it started when they first added fluoride in the water back a few decades ago. There was, between public health standards and everything, there was so much contention. And then that argument kind of got put to rest for a little while until, some certain politically charged individuals started bringing it back to the surface. But I will say there have been some recent studies that we won't say no one's proven causality now. These are epidemiological studies, but they have shown that fluoride exposure in pregnancy is at least correlated to some decreased IQ at ages 3 to 4. And, you got to be careful with some of these studies. Like a lot of them coming out of India and China the fluoride exposure levels are huge, way above what's recommended in North America, which is like 0.7 milligrams per liter. Yeah. But there was one study done in JAMA Peds in 2019 that was Canadian women, all within normal fluoride exposure levels. And they sure enough showed they followed those women until the kids were ages 3 to 4, and they showed a little statistically significant decrease in the IQ levels. So,
wow.
It's enough that at least it gives you pause, especially in this country where, over 70% of Americans get adequate fluoride just through the drinking water. To have another remineralization product that you can use in toothpaste is interesting for sure.
Yeah. I'm also curious because like in the water, now you're ingesting it, right? Now it's getting absorbed through the bloodstream and such, and now it's getting transported throughout the body. Actually, it's funny. On TikTok, I was just asked this 2 weeks ago about fluoride. I was talking about fluoride in the toothpaste, and they're like, yeah, but, the whole fluoride thing linked to IQ and stuff, but you're not swallowing your toothpaste, right? Do you swallow your toothpaste? Duo toothpaste? Do you swallow it?
No, you don't. You spit it out. But it's actually been studied, like 5 to 8% of all toothpaste is swallowed. So no matter what, we're all swallowing some toothpaste.
And then
And that,
that's a small percentage of fluoride that actually, within a small percentage that actually gets swallowed. And then how much of that actually gets absorbed compared to drinking water all day with fluoride in. I don't know this stuff. I don't know all the
yeah.
research on it. I did see the article linking the IQ though, which was kind of alarming. But yeah, and you got someone like India. And yeah, I find this stuff fascinating because I don't know the answer, but I'd like us to find out, you know?
Yeah. I mean, it's, you know, can you imagine now in 2025 if someone just proposed like, hey, we're going to start adding this one thing to the drinking water? I mean, it would absolutely never happen. So now we're kind of left with this legacy thing. And just to be completely clear, like it's been an incredible benefit for dental public health. Like there's no doubt that adding fluoride to the drinking water has decreased the caries rate and improved
Right.
dental health.
Right.
So now the question is just, is there a side effect? And that's still being teased out.
Got all these stupid people running around. That's what this.
Yeah, I know. Yeah, I was reading one thing, you know, it's talking about some behavioral issues potentially with Florida or whatever. And meanwhile, I've got a 15-month at home, and he's just sitting there, just banging his head against the window. Like, Florida, or is this just my son?
The fluoride got to him. That's what happened. What was
Yeah, you know, we'll never know. It is what it
secretly
is
young,
now.
right?
Yeah.
So how'd you come up with Duo? Where did because I do the Duo lingo Spanish lessons every night, but how'd you come up with Duo for your toothpaste tablets?
For the name, yeah, that was a fun process going through like building a brand because we started with scratch, right? So we actually had
Yeah.
a brand designer that helped us out. Happened to be a friend, but also someone that's done a lot of impressive design work, and that was a really cool process because you go through so many mood boards or whatever, and you kind of you start with the name and then the color palette, and the brand expression, and so the name was the first start to that process. And Duo is because at its core, we're making the best tablet toothpaste possible, but then we added these functional ingredients as well, right?
Mm.
So the
Mm.
whole idea is do more with your toothpaste. So not only are you brushing your teeth and keeping care of your oral health, but you're also getting a little melatonin and L-theanine at night to help you fall asleep. So kind
Mm.
of the two thing, like it's got two benefits, if you will. Also, I mean, it's then you just kind of wordplay. I mean, Duo, we always talk about 2 minutes of brushing your teeth. So the two thing just kind of
I like
felt
that.
right.
I like
Um,
that.
at the time, the team was two married couples, so it was like a duo of duos, which I think our group thread is still two duos.
Oh, that's cute.
So there was just kind of a lot that played in with it, and it was one of those names that I think we had six that we finally debated, and we were able to toss out three immediately, and then I don't know, duo just felt right, and so
Yeah.
here we
And
are.
then you were working with another couple you were saying, so two duos, but then now you have a person who helps you, third teammate. Now, what happened to the other couple?
Yeah, we have five co-founders. They're still involved.
Yeah.
We just needed, that's also been a very interesting thing to build this team. We're very fortunate to start out with a very strong core of four of us, different skill sets. Stevie, my wife, is a general dentist. I'm an oral surgeon that also kind of has this like duality of medical and dentistry training. And then the other couple, one is very much in the creative space, kind of producer directing kind of thing.
Oh,
That's very helpful with building a brand. And then her husband, Nick, was originally went to law school and practiced corporate law for several years, went off, then did some other startup things and work product. So we kind of had this robust skill set that worked for our whole team. And then we've since brought on Mike, who also went to law school, but really had a finance career. So he brings some of that knowledge to the team.
I see. Yeah, that's
So everyone's still involved. We're just now we have this very core group, and then that's really it for employees. The rest of it's contractor work.
right. Okay. I like that. I like that because I have two little projects on the side here. I guess yeah, so two LLCs, but yeah, the team. I must say it's pretty difficult during residency because you're lacking the two things you need as a startup. You're lacking funds and you're lacking time. And dental school is tough. You have a lot more time than you have in residency.
Yeah, and more flexible time too. I mean, residency, it's such a hierarchy. Things are pretty rigid, so you got to do what you got to do. But yeah, no, time
Where
is
where are you
short.
located, by the way? What state are you in? Where'd you go to residency? I didn't get a chance to look everything up, but I wanted to ask you anyway on the podcast to kind of get to know you a little better.
Yeah, so I'm originally from the Seattle area, and that's where we are now. I
Yeah,
went to the
cool.
University of Washington here in Seattle for residency. My
And
wife's from
and I'm sorry to cut you off, but you're in Seattle. How far are you away from like the city area? I've never been to Washington. Well,
That was going to be my next question. Yeah. We're in the city. We actually my wife and I live in a floating home. So Seattle is surrounded by water. On like the west side of the city is the saltwater, Puget Sound that comes in.
You're on water right now?
I'm floating. Yeah.
You're floating? I was gonna say, I'm seeing things move a little bit in the back.
Yeah.
Oh no.
Yeah, no, it's pretty awesome. It's like it's an urban lake, if you will. So
Oh wow.
it's a pretty cool deal. But we're just minutes away from the downtown area.
So you get to and from by boat, or do you have like a little parking spot? How does that work?
Yeah, so we have a dock that has, we have a boat out back, so the boat can do boat things. And then we we have two parking spots and a garage that's just off the dock. So we also use cars, and we do travel by land still.
Oh, sweet, sweet. Okay, that's so unique. I've never heard of anyone like living on the floating house.
Yeah, I mean, Portland's got some, San Francisco has some, Seattle's got a bunch. And I don't really know about I mean, Paris has some. I don't know if there are any on the East Coast or not.
Huh?
But
Do you like?
it's a pretty cool thing.
Is it like a big house? Do you have like one of those? Are you sitting on like a yacht-sized house right now? I don't know. I don't know what to.
Yeah, no, from the outside, it looks like a house, right? 2,000 square feet, 4 bedroom, 3 bath. I mean, they're small bedrooms, right? But it looks like a house. Doesn't look like a boat at all. There's actually a distinction between a boathouse and a floating home. So a boathouse actually has to have a motor and like disconnect from the dock and all that stuff. Where a floating home, which is what we are, is fully fixed on the dock. And there's some
Got it.
whatever tax and legal implications there. But
Yeah, you grew up
one benefit, very little property tax because, we're floating.
Right. That's a great perk. Did you grow up in that area on a floating house, or?
No, not on a float. I grew up in Issaquah, which is just a suburb like 15 minutes east of Seattle.
Oh, okay, cool.
Not
So you
literally
and then
floated.
your wife, who's also, by the way, what specialty in dentistry? General dentist, pediatrics?
Yeah, she's a GP. So Stevie, she grew up in Philadelphia. Do you know Philly at all?
A little bit more than Seattle.
Okay, yeah. So she grew up in Rittenhouse Square, and where both her parents are actually dentists too. And her parents, their primary practice is a brownstone on the square. So she literally grew up in a dental office. Like the first 2 floors of their house was a dental office. Yeah. And then we met in Boston. We both went to Tufts for dental school. That's where it all came together.
That's where it came together. So you went all the way to the opposite, like literally the very opposite of the United States. Where'd you go to residency?
And then University of Washington here in Seattle. So when we first started, we did a little long distance. So we graduated dental school. We did a road trip. We rented a motorhome and we drove all the way to Seattle with like a little bit of what we thought was furniture we wanted from Boston. I don't know if we use any of that now. Great trip. And then I started intern year, which is pretty intense. So I had an apartment here, and then she went and did like the best GPR possible, which was just working for her two parents for a year. And then she moved out here and joined me, and we've been here ever since.
How many years did you do the long distance?
Just over a year.
That's a tough year. Yeah. And then intern year, but it all came together. So you had an end date in mind, right?
An end date, you mean of graduating residency or just a long distance?
Moving over to you, right?
Oh, yeah. Yeah, I mean, it was great because she was able to go back after dental school with all these new skills and really hone them in with her parents, working for mom and dad. Intern year, I don't know if were you in a relationship or anything during intern year? It's hard on the other person too, because you're just gone, you're drinking from a fire hose, you're stressed out, tough time. So it worked for us.
That is true. Yeah. So she was busy kind of almost. She didn't do residency, you said? A GPR residency?
No. I was just, I guess, being facetious. She did her GPR version of that was working for her parents, but she didn't do anything official.
That's awesome. Yeah, that's even better. She learns the trades of both her parents working that must have been like nice to see for her to come full circle,
Yeah, to finally understand like what was going on in the basement of her house all those years growing up. For sure.
What's her last name, by the way, or was her last name? I don't know if she
still is Stevie Roberts.
Right. Okay. While you were in residency, was there another Stevie that came through from Stony Brook University?
Yeah. So Stevie, yeah. So that's she funny. Was non-cat. I forget what year I was, but I think it was kind of med school, but I got to know her a little bit. And then she's back. She is in residency at
Thomas Jefferson.
At Jeff. Yeah. Which is just like blocks away from her. Yeah. So we keep, she actually goes, now that Stevie goes to my Stevie's parents for her dental work.
No way.
The whole world kind of came together. Yeah.
That?
Is that where you went to dental school? Stony Brook? Is that how you know her?
Yeah, that's how I know. She was a year above me. So that's
okay.
Very few Stevies. It's kind of like a rare name.
Right.
That's
Yeah, no, for
yeah.
sure.
So again, connecting the dots here. So you're off today. What days do you practice? I'm curious.
So I actually, during residency, I talked to this guy, sole practitioner, for like a couple of years. I'd like every 4 months or something go have lunch. And the original plan, I was going to join his practice. He was going to kind of ease out over several, 3 to 5 years or something like that, and then do a transition. But it's kind of a tale as old as time. I got there, and all of a sudden, the idea of him backing off and making less money and stuff, it was kind of seeing that that's probably not going to happen here. Actually parted ways in January. And then right now it's actually a great model. I'm really enjoying this, going into dental offices. So I go into Stevie owns her own dental practice here. So I go in there. My dad's actually a dentist here in Seattle. And then I got some family friends. So I go into those dental offices. And then I am actually interviewing with, it's not Clear Choice, but it's kind of like that full arch DSO
Yeah.
situation.
Yeah.
And I'm hoping that works out because I'd love to pick up like a day a week doing that. I really didn't have that much experience with like zygomatic implants in residency. We did a couple, but it was always with like a hemimaxillectomy or, some reconstruction indication or something. So not your typical full arch deal. So yeah, anyway, that's kind of where I'm at. And it's been good. I learned a lot from this guy. Like he was great clinically, kind of learned about the sole practice owner and what that's all about.
Mm-hmm.
And I'm really, especially with things like Duo going on, and again, I got like a 15-month-old at home. I'm really enjoying the flexibility of going in some dental offices and then
Yeah.
augment that with this kind of also a DSO gig. It's nice, keep your skills up, some growth potential, but also, when you have like Duo's going so strong right now, like it requires some attention. So I can't just be grinding away by myself in a private practice 5 days a week, which when you practice as a sole practitioner, you kind of need to be available for both your referrals and your patients 5 days a week. And, there are pros and cons to that, right? Like, but it's definitely a lifestyle decision to be made there.
Yeah. Yeah, yeah, you got a lot going on, and you're fresh out of residency too, so it's really starting to pick up. That's excellent. I really like the idea of not the Clear Choice, but whichever full arch practice that you're thinking of working for, because then that you could take back to the other offices and start to set up some full arch stuff for those kind of bigger, more complex, needing a full revamp. I bet the referrals, and your wife would appreciate that to have that kind of in their wheelhouse. To all right, we're at that stage. It's going to be expensive, but this is what I would recommend, and then that just serves it up right to you. That would be pretty neat. That would be a good setup.
Yeah. And, with full arch, there's so much, obviously there's the procedural part and some skills that come with that, most of which we get during residency. But a
Yeah.
lot of it that'll be interesting is the workflow. I mean, these
Mm.
DSOs have it really dialed, and working with the prosthodontists and really getting those reps in of doing the same thing day in and day out, I think is really important versus just doing like your one off all on X case, and then you critique yourself in your head, but you don't have another shot at it for 3 months. Like
Yeah.
that's not so much of a learning opportunity. You got to get those consecutive reps in. So I'm excited to see what it's all about.
It's a really good point. Yeah. Yeah. That's kind of what I start in August. That's kind of going to be like the setup that I look at. We're working on Facebook advertisements and Google PPCs, really more so Facebook. But before that, that's going to take time to kind of build up. And I mean, it would be nice to start with like one a month maybe, but exactly what you're saying. In the beginning, it's going to be maybe like one every 3 months,
Yeah.
especially in very populated areas. Other general dentists, periodontists, prosthodontists now, they're doing them themselves, which is, I don't know. Yeah, the landscape's changing, but that's pretty cool. Did you form an LLC since you're kind of like the hired gun at the separate offices, and then they just hired you as like a contractor? Is that
I didn't with the other offices. I mean, I talked to my accountant about this, and he actually encouraged a W-2. I mean, he said actually the tax implications with, I work in each of these offices like once a month. So with that income level is like, tax implications are about the same, and it's just so much easier to do a W-2 is really the justification I got. It will be a 1099 with this more DSO setup. Yeah, so that's kind of where I'm at right now.
That makes sense. Yeah.
But it's everyone's situation is so different. I mean, you just got to talk to an accountant or lawyer to get your advice. Don't take it from me.
Yeah, I'm just starting to look at all that stuff now, like the financial advisor, getting the disability insurance. I want to buy my dad's house. These things really start to pick up, and you're like trying to finish out residency in peace, but there's no peace.
Yeah, there's no peace, but those are all good problems to have. Are you gonna jump right in? Like, do you know what you're doing already? Because
Yeah,
you're in your last year, right?
yep, three months left, and then it'll be like 2 months off. That's just what he gave me. I was like, all right, I'll take it. I'm not gonna get
Yeah.
this again. So, and then it's a multi-practice. It's like 6 offices, and I worked into my contract where I'm just at one office, and then we're already doing the marketing for them now. That's one of like the LLCs, the side of things to try and get that going.
Sure.
And when I walk in, I wanted to like have something already set up, which we do, which is pretty cool. But we'll see. It's just an associate contract, 2 years, and I'm hoping you faced that and you separated with that partner back in January. I'm hoping that that doesn't be the thing, or even worse, I hope that it doesn't get sold to a DSO, and then I'm kind of like stuck my pants down.
Hmm.
But yeah, there's no partnership guarantee, so I kind of I'm kind of taking that risk. But I'm also hoping that if I can kind of prove myself in the time being in these 2 years, maybe I could earn that. But he's got 5 or 6 surgeons working for him, and none of them are partners. So that's a flag. Yeah,
Yeah.
I mean, I won't bore you to death with this. It's something kind of in perpetuity in the back of the mind, you know?
Yeah, no, I mean that's all interesting, and it's a lot of practices. So I totally get the situation I was looking at. I wasn't really worried about the sellout to a DSO, and that's a whole nother factor to think about. But there's so much that contract's important, of course, right?
Yeah.
But there's so much that the contract's not gonna. You can't write in like a partnership track very well that's enforceable, to my knowledge, at least in Washington, is what I was told. And there's only so much weight a contract can do. A lot of it's just
Yeah.
you just got to show up and do the work, learn what you learn, and kind of hope for the best, and make the best decision with the information you have, and see what happens. But
Yeah. Yeah.
that sounds like a great. I mean, that'll be nice because what I learned, I mean, certainly a practice that has never had an associate before, doing that was a hurdle. That's a skill set that here they're kind of in the twilight of their career, because it was a husband and wife. And so they had never really had to try to do that. And there's certainly some learning curves there. So that's encouraging. He has so many associates. And
Mm,
at least
mm.
for your onboarding and your associateship, that'll probably be great. But I hear you. If none of them are partners yet, that might be a bit of a flag if that's your goal.
Yeah, it
Yeah.
is. It is. I don't want to. I don't want to get caught up in a DSO. I just don't have that interest of working in the corporate environment. It's kind of why I went into dentistry. I mean, I'm sure you kind of
Mhm.
have thoughts, but like a day a week at like a clear choice. That's something else, and I think you're going to benefit so much more from that than it will be like a. You know what I mean? So that's a separate model, but.
Yeah, and it's like any career. We just start so much later in life that when you come out, just try some things and don't be afraid to pivot. And if the first thing doesn't work out, it's not that big a deal.
True, true,
Yeah.
true. I guess I have, in a sense, more of the mindset. I mean, I've been looking for practices for 2.5 years just to see what's out there, and that's why I selected this one back in like August. But I think you and I have a similar mindset where, I mean, look, you own your home, right? You have a kid now. You and your wife, you're working on Duo. It's your outside project, a hobby, but also a company that can really take off. And I think you're doing good things with that. Also, just a side note, how'd you come up with like let's put caffeine in the toothpaste? Whose idea was that? Was that you, your wife, or
That was one of the other couples person that actually started that because the whole thing started. This was like it was late at night. We're on vacation and we're having so much fun, and then it's like bedtime, and it was the other friend that was just like just bummed out that she had to end the night after it had such a fun night with something as lame as brushing your teeth, right? So we're trying to add some excitement to the whole thing, and these other ingredients, like when we added vitamin D and B12, we kind of went to the science. How much is absorbed? What's the dose? What should we put in the toothpaste? But with caffeine, it was like, well, what does it feel like? And it was kind of fun. Like we started with some pretty high doses, and you're just like, your eyes get, your pupils are dilating. And you're like, oh, like, too
really
much,
just
too
brushing
much.
with the caffeine? It really like explodes like that?
I mean, because it absorbs through your gums, right? Mucosally,
Yeah.
sublingually, and buccally as you brush. And so it's not like coffee where you have to wait for the effect to absorb through your intestines. It just kind of hits. So like we in the end we settled with just 10 milligrams of caffeine, but it's enough that it just gives you that extra little zip so you can
Yeah.
get to work, get to your cup of coffee or what have you.
Sounds like I've never tried one, but one of those Zens where they're like the people are packing their lips with the Zen.
Yeah, I mean, we actually thought that was going to be more of a challenge with Duo is explaining the concept of mucosal absorption, right? That you don't have to swallow a pill to get your vitamin D or whatever.
Mm.
but it's so intuitive for people, it seems like, especially with products like Zyn and chewing tobacco and other recreational things that absorb mucosally. People were
Yeah.
actually, we were all primed to have to over explain that and, do all this education about
Mm.
mucosal absorption, but that just really has not been a barrier because I guess we'll credit Zyn.
Let's credit let's credit Sid. I actually have a topic that I'd be curious if you could research. Something that's come up recently with a dentist that I know. He was saying that after he takes out a tooth in the extraction site, he's putting melatonin in the alveolus
Mm.
inside the site. And I don't know if he's suturing it or whatever, but he's saying that he's seeing some really good effects. Now I forget if it was dry socket or like bone growth, almost like a bone grafting, but it kind of just spurs the. I don't know if there's any research behind it, but I'd be curious if by using, you said melatonin in the tablets, by people brushing with this at night, I'm curious if it could potentially like halt bone loss and periodontitis. That's something that if you could show that, I really think that's it for you guys. Like no more
Yeah.
working, you know?
There's actually a great, I mean, there's a bunch of research on this, but there's great, I think it's called Physiologic and Pathologic Implications of Melatonin in the Oral Cavity or something to that extent. It's a great
Mhm.
review article of just the topical effect of melatonin in the mouth. A lot of it is credited to it's just incredibly powerful antioxidant. So it has been shown to help decrease lesions, gum disease, all that. That being said, how the heck did this guy come up with the idea of just going to pack an extraction site with melatonin of all things? That
I
is,
don't
what
know.
else does he pack in extraction sites? Like that's, I mean, what, I'm so curious what dose he put in there too. Like he just sends the patient. That's wild.
I have you on Instagram. I'll DM you. I'll ask him and I'll DM you that stuff and I'll get other information and send it your way. That's because this is something that I've been very curious about. I mean, I did some stuff on vitamin D, so obviously we know the benefits of that, especially in like getting patients' vitamin D levels up prior to implant placement, prior to
Yeah.
osseointegration, seems to help. That's like very straightforward. You know what was it?
What was your vitamin D work? I'm curious.
It was like a lit review kind of thing and putting all together. I mean, it was more of just like I was like a bystander to kind of help put the article together and organize it and then push it out. We started it like a year and a half, 2 years ago, maybe even longer, and it went out a year ago. It finally got. But I don't know. Research isn't really my thing. I feel like there's just so much stuff involved. It takes forever. I don't know. I'd rather go like the company building route that you're kind of on, inventing new products rather than the research behind it necessarily.
Yeah. Yeah. It's been, you get so used to, which is a good thing in medicine, evidence-based medicine and
Hmm.
every move you make in the hospital is, backed logically and by data and stuff. And in Duo, you kind of have both worlds with a CPG product because yes, we use all the research to develop the product and talk about it and, say scientifically critical things. But then you have the other side that's like marketing where it's just like, test stuff and it fails or it doesn't. And it's
Right.
kind of fun to have that side of it where you have this freedom to just kind of break some things or just, throw it out there. And the implications are a bummer because it, just costs more to get your product some traction or whatever, but no one's getting hurt. And so it's kind of fun to kind of have that side of things because we don't have that so much in surgery.
Right, right. Trial and error, right? You can't just
Yeah.
try something and screw up a patient's face. Like I
Right.
agree, you know?
Yeah.
So it's pretty cool in marketing. And then sometimes if you have the funds or the time to really do it, you could get some repetitions in. I don't know if you've been experimenting with AI at all. I'm not sure where that could kind of tie into to Duo, but I mean that I've been trial and erroring that for like 2.5 years now, and it's been outstanding. A little
Really?
less.
Like with actual production of your videos or what kind of stuff?
The captions of the podcast.
Mhm.
So Riverside gives me like a transcript and chapters and stuff. I just copy and paste that into ChatGPT, and I have a prompt. I have actually like 5 prompts, and then I run it through those, and I pick this from there and that from there. But it gets something that would probably take me 2 hours down to a couple minutes, and then it gets like the whole kind of transcribing, like preparing the episode to post it. It's down to 30 minutes. So it's pretty cool because as a resident, there's like no time, and everyone kind of just looks at me like you're definitely not studying, you're definitely not working, you're just doing social media and stuff. And I'm like, I've been working on AI for 2 years and I pump this stuff out. Like, I don't know. It's kind of interesting, but
Yeah,
yeah,
no,
what
it's great.
try,
We
you
haven't,
know?
yeah, we use it a little bit. I do like, I built a GPT for our blog. Part of what I do is
Did
like
you?
article analysis. So it's pretty cool. We actually learned this in residency. Our program director, Dr. Dodson, is the editor of JOMS. And
Dodson,
so
that's right. Yeah.
yeah, so we've got a very research heavy program in some respects. And so part of not what the residents have to produce, but just the interest in research, which is
Right.
cool.
Right.
And part of our didactics was this journal club where, it's like black and white PowerPoint, a very certain format where you just break it down. Like you got to have the perfect Pico question or you're just going to get ripped at 7 in the morning on a Tuesday.
Yep.
So, and what I did was I basically built this GPT. This is what I tell people to be Tom Dodson. So now it's pretty cool. You just upload a PDF and it just spits out like our journal club thing and the exact, because it's a really useful format. Like there's a reason for it, right? It goes through, you take apart these research
Right.
articles and you just break it down to a Pico question and primary variables and actually make it digestible. And that's pretty much what the Duo blog is now, just different interesting articles that I let my Tom Dodson GPT go
Yeah.
through and analyze and put it up there. And I mean, those PowerPoints you used to make, you'd be on call and then you get back for 2 in the morning and your didactics start at 7. So at 4, you're cracking into a paper, making a PowerPoint and
Oh,
going cross-eyed and say, if I had this GPT in residency, it would have saved me so much agony. I mean, it's
right.
crazy how productive, because I mean, you're busy as a resident, but no matter what, if you can be more efficient, that's to everyone's benefit.
Exactly, dude. Time is everything, and I don't think I don't know. Everyone likes to dismiss technology for like I don't know what would be something something that people are. I mean, you get it though. The fact is like AI is coming about, and people are demonizing it, and then they see the advantages, and they're like, oh, it's so great over here, and I don't know. There's the change, adapting the times is always so. Nobody likes change, and
Yeah.
to adapt to the times, everyone's got to be a critic until it's like like,
Yeah.
oh, I'm never gonna get an iPhone. I want the BlackBerry because it's got the buttons.
Right. Well, yeah, and especially in certain industries, I mean, we can speak to surgery because you know, certain people have been doing it so long without that technology. A
Yeah.
little bit of an ego thing maybe there, or it's just they encountered so many early technologies that really didn't pan out, had all this promise. So like some
Yeah.
people are just jaded by it, or just because it's a better technology. If your workflow is slower or it's more expensive, then like, is it better? So kind of goes back to that data driven thing in
Yeah.
medicine and surgery where sometimes quick adopters, but more often than not, I think I see slow adopters just because of all that.
Treading lightly. No, that's a great point. Everyone's treading lightly, as we should be. I think I like the trial and error, the marketing side, trial and error, rapid fire stuff. But it's something that's really interesting that you made the GPT engine. You said it makes a question too.
It'll make the Pico question. Kind of our journal club thing was, you go through it's the declarative title, and then you have to say if there were funding sources, and then it's a Pico question, then what were the primary variables, secondary variables, and then it kind of transgresses into like other explanation of the article. But Dodson's whole thing was like the most complicated papers in the world can usually be boiled down to a 2 by 2 table. So just taking a
Hmm.
ton of information and breaking it down to be as simple as possible to be able to digest it and get to the answer that you're actually trying to arrive to. The
Wow.
statistics section that goes through and talks about which software was used for the biostats and stuff, like that all has to be there for the sake of completeness, but not that valuable to your average reader.
Right.
They're
Right.
trying to
Right.
look at
Unless you know.
the
Yeah.
core information.
That's really interesting. You should sell that GPT, get it to some residents for like.
Yeah, I know. I made it under the Duo GPT. I did pass the idea on to some residents that are still in the program that are pretty damn savvy. So hopefully they do that and pass it around. Dr. Dotson's going to be thrilled with how good everyone's Pico question is, though. Yeah, yeah. I'll check out the blog too. You'll see it there. It's pretty cool. But
Yeah, yeah,
yeah,
yeah. But yeah, man. What else? Any other topics we could go over? I gotta start getting ready for. I gotta do a maxillary all in X tomorrow. But
so
what else?
yeah.
Any other topics we can touch on?
No, I just thought it would, I've enjoyed watching some of your content and stuff, and it's just interesting to see different career paths. And I think, you're I mean, it seems like you've really figured out a way to balance a lot during residency and you don't have to do that. I thought it was kind of, especially during med school, like you're learning a lot, but I felt like I was kind of spinning my wheels as far as my career. I mean,
Yeah.
yes, on my bariatric surgery rotation, did I pick up some skills? But probably not a ton that's super applicable to oral surgery. So you're just kind of like, you're doing the work, you're doing patient care, and
Mhm.
it's all there, but you're kind of spinning your wheels a little bit. So it's fun to have another project that's also scalable because
Yeah.
clinical work is so interesting and it's I mean, there's nothing like the patient satisfaction and helping people, but you can only help as many people as fast as your hands move is really
Hmm.
how it works. And so to be able to work on something that could touch many, many people in a positive way, I think has been a really cool thing. And like we talked about, like the careers in oral surgery or just dentistry in general, it's not like it used to be where you'd come out and like the question was, are you going to start a practice or join a practice? And
Right.
then, it got a little bit, a few decades later, then there's like multi-site practices. And then, of course, what started as corporate dentistry now referred, DSOs and stuff. So, I think it's just important that people know there's a ton of career options out there. And like we talked about, to just try different things and see what works, see what fits with what you're looking for and what doesn't.
Yeah, man. Yeah, and well, also I appreciate you watching some of the content and stuff. It's that's such a great analogy. You guys were on bariatric surgery too?
Yeah, I had to do 2 months of it,
2 months.
which I'd be curious have you done it recent? I'm curious what that department looks like with Ozempic.
Right?
I'm
Yeah.
sure that's been a good wrench thrown into the system.
So you were on one of those bariatric rotations where they're just pumping out patients all day. They barely even see them.
No, it was a very comprehensive bariatric unit. I mean, the patients would
Okay.
be seen within the department for a whole year and had to reach certain criteria before they could even undergo the surgery.
That's appropriate. No, that's
Yeah.
much different from what I've seen. I
Oh,
like
it,
that.
it was great. And like, I mean, teams and nutritionists and dietitians and psychologists and stuff to
Wow.
really get to the root cause of, why we're getting the point of doing bariatric surgery. So it
Wow.
was a phenomenal rotation and department and patient care and all that is just a far cry from oral surgery, especially because most of it, it's laparoscopic stuff. So
Hmm.
even the surgical touch points, you put in a port site at the beginning of the surgery, you stand there for 2.5 hours and you sew up that one port site with a single
So
stitch, and you're like,
particular. Yeah. Or yeah.
surgery, baby.
It's so annoying, and it's exactly what you said. You're there all day. You're doing the work, but your wheels are turning. None of it. I mean, none of it actually benefits to you as an oral surgeon. You're just there as like a body. I probably did because we were doing like 5 a day. I've done well over. I've assisted on well over 100 sleeves, bypasses, and they're just like pumping these patients through and getting yelled at for moving too slow. What do you want me to do? I'm like suturing it up, dude. Like
Yeah.
I'm not a hand
My
to.
time to shine. I've been standing here for 2 hours. Let me throw this perfect stitch here.
Yeah, yeah,
Yeah.
yeah, yeah. You got this attending yelling at. Oh my god. Yeah, you like what? I didn't, dude. Why are we on bariatric rotation as oral surgery residents?
Yeah. I
Whose
mean,
idea was that?
I don't know. I mean, sometimes you just do need warm bodies in the hospital, and so
Did you go on ENT? Did you rotate on ENT?
I really didn't get that much time on ENT. I was supposed to have more time during med school, but my schedule got kind of blown up with COVID, so
Right,
unfortunately, didn't have as much time on ENT as I would have liked.
right. Same here. We don't rotate
Really?
on ENT. We do hand plastics, but they
Yep.
throw us on hand most of the time. And then
Yep.
ENT we miss, and we do bariatrics. You did 2 months of bariatrics and no ENT. This.
Yeah. Yeah. No, I mean, there was a lot of the trauma and all that stuff's great. Did a month of cardiothoracic surgery where this service, the one we were on, was basically all lung transplants. And so it's really thoracic ICU care, but, as the general surgery intern, I'm just kind of pulling chest tubes and, stressful work and maybe not super applicable. I know my way around a chest tube now. If that ever comes up in my life, but hopefully not in the office.
You need a chest tube. You
Yeah.
need
Yeah.
just walking through the waiting room.
Yeah. I feel good. My wife, she really likes watching like medical dramas like The Pit. So
Oh,
makes you feel like you're in there and,
true.
been
Yeah.
there. Nope.
I can't watch those things, man. I'm trying to get as far away from hospitals on a daily basis.
100%. But I mean, now I like The Pit's a great show and I can watch it, but some of them, like the pager beep is the same as what my pager was. And she tried watching, was like, we got to shut this down. Like, I'd rather listen to some Bravo reality right now than this
Yeah.
pager going off.
Yeah, dude, that pager will still freeze me to this day. I'm sure it's like a serious PTSD of hearing that beep in the middle of the night that you just fell asleep and now you got to run back. All right, we don't have to go there, but
Yeah.
bad memories. I'm still in it. I got a couple more months, but yeah, yeah, dude, I want to see what I can. If there's any ideas, any type of marketing assistance I could give you on. That was very kind of you to say that. I've kind of figured out to a science. Like, I mean, I literally just walk out of the hospital. I talk about one topic that day. I get it up within like 10 minutes on 3 different platforms, and then I pick the best one that does over there. and bring it to Instagram. And my
Interesting.
point of this is like, it's a little formula, but it's about what formula kind of matches you, your schedule, what your skills are. Like, is it actually writing? Is it actually talking? For you specifically, I would actually recommend looking into LinkedIn. You said you do a blog post. I
Okay.
would dump everything on LinkedIn because it's B2B marketing. So like clinician to clinician, you're not getting patients from LinkedIn. You're
Right.
connecting with your colleagues. And by being able to talk with colleagues, just like talking about this element of the toothpaste, the nanohydroxyapatite, why not no fluoride in yours? Have you tried melatonin in your toothpaste? Just a little quick blurb, maybe a couple hundred characters, something that people on LinkedIn can read that's educational and is linked to their career. I think that would increase some exposure and give you that B2B, like, hey, let me send you guys have a high volume of patients in your office. Let me send you a box this month. I'm really curious what you think, what your patients think, and let me know how I can make it better for you.
Yeah.
Just to see some ideas like that. I don't know. I love spitballing, brainstorming ideas, and it sounds like the project you're working on. I'd really like to get behind you and support it in any way I can. Just
Yeah, I
support you.
appreciate that. That's really an interesting concept where you test it on different platforms, and then if whatever's successful, if you made Instagram your main one, then you plug it in over there. And that routine you're doing is so good. It just, you walk out of the hospital and you record your video. Because I can spend hours just getting worked up and record 1 30-second clip. It's like,
That,
where's the day gone, you know? And
exactly.
I
You don't
don't
want
I
to do
don't
that.
think the content's better than if I had just filmed it off the cuff, immediately. Those 2 hours didn't benefit me. They're just sitting there stewing.
Exactly. And then, yeah, I put a lot of work in LinkedIn, and the written posts on LinkedIn are excellent with a little
Interesting.
fat, little tidbit, little, see, try it out. You could use ChatGPT, or I also use Grok, but ChatGPT is better for that right now to do those things. Yeah, man, play around with it. And there's so many options. Sky's the limit with these things.
Cool. Yeah, and man, you're really a duo resource. You've also worked on vitamin D. I'm gonna go look up your paper.
Tell me what you think. You could be honest. You could be honest. I'm curious what your thoughts are. I think it's kind of like summarizing everything. We all knew the vitamin D level kind of had something to do with it, but it kind of took an approach where, why don't we take some time to get the patient's vitamin D levels up? Yeah. But gosh, it's been 2 years since that was like written. So it
Yeah.
started out a little bit.
Did it
But
just come out? Isn't that crazy how long it takes? Like even when you're done with the paper, it takes forever to get out.
yeah, it's like, was that even in my paper? Was that a different one I've read a couple months ago?
I remember I had a an interview, and it was at Yale. So I'm like, all right, I gotta do the whole thing. And it was such a good interview question in hindsight that just kicked my ass. It was the last thing I had put on my like research was just a poster that I was a part of. And when I put it on the resume, like I knew the poster for sure. But the question was, and I forget, it was like aggressiveness of benign tumor. And their question was aggressiveness of benign tumor, finish that sentence. They just wanted me to remember the title of the paper I put on my resume, and I couldn't do it. I totally just froze because, man, I worked on that thing years ago and then put on my resume. It was legit. I knew it at the time, and then
Yeah.
they got me.
Do you think they go around asking people if they did a research project from years and years ago? Because that's like, how do you think of that? I feel like did they ask you more questions on the article, or was it just that the title? You know what I mean? They were trying to trick you
No,
kind of thing.
it was just the title. And I think the next question, because my wife's from Philly, was, what's your favorite cheesesteak? It was just, they were just, firing left and right. There was,
Oh, all right.
yeah, it was just a trip up. Quite, there was nothing, no follow up. They're like, all right, let's move on.
All right. Well, that's fair enough.
Yeah, it was good energy, but it was a failed question on my part.
That's funny. All right, man. I gotta pack in and get ready for tomorrow. But dude, thanks
Yeah.
for coming on. Thanks for reaching out to me.
Yeah, no, thanks for having me. It was great.
Yeah, keep in touch. Send me a
Keep in touch.
DM, and I want to hear more about your marketing steps. I want to see if there's any way I could strategize you. I keep in touch with a couple people, like literally anywhere from, I have a friend doing eyeglasses. She has her own eyeglass company. So
Cool.
like dentistry, marketing. I don't know. I find it to be fun. I want to see if there's anything I could figure out that helps.
Yeah, no, I appreciate that. I'd love to talk more. We'll keep it up.
Yeah. All right, brother. I'm
All
gonna
right.
I'm gonna hit. Don't sign off just yet. If you could just wait 10 seconds after I hit the button, because otherwise I gotta email you to like log back in.
For
Just
sure.
give it 1 second if you can. All right, man. Good night.
All right. So, dude, good luck tomorrow.
Thank you.